disease is caused by bacteria called Mycobacterium avium subspecies paratuberculosis, or MAP for short. So it's a bit of a mouthful. Now, it's a disease that's found in the gut of the animal, and it causes gradual thickening of and inflammation of the intestinal wall, which eventually prevents the uptake of nutrients. So your cows end up losing weight despite feeding them up and spending good money on a lot of feed. The clinical signs can include weight loss, diarrhea, drop in milk production, increased risk of other diseases, and also reduced longevity. There is no cure for the disease, and it needs to be managed on farm to prevent the transmission, especially to those younger animals and the susceptible calves. Transmission occurs primarily via the fecal oral route, but the bacteria can also be transmitted through contaminated milk, through colostrum, or through Johne's positive cows to the calf in utero. So the animals most at risk are calves and young stock, and the highest rate of infection is in the first 30 days of life. Usually animals aged 18 months and over don't normally show contamination or Johne's. The disease has a long incubation period, meaning it can take many years before the animal starts shedding the bacteria in the feces or showing any clinical signs. So the shedding of the bacteria in the feces is usually intermittent, so it can be very difficult to identify these animals until later in the disease process. So what do we know? We know that the prevalence has been estimated to be as much as 60% in the New Zealand herds. Interesting enough, we visited some vets recently and they suggested that it was actually a lot higher than that. They were hard pushed to find any herds that didn't have an instance of Johne's in there. But just because it is present in a herd doesn't mean that it's causing a massive problem, especially if you've got management practices in place that are naturally limiting the transmission of the diseases on farm. So the onset of your clinical signs is typically between the ages of 5 and 8 years. And if we look at the data from MINDA of animals that have been recorded as JD cows, the majority of these animals recorded for culling are 5 and 6 year olds. So if you look at the graph that's on screen, you'll see that most of that happens August, September, October. But it's still possible for young animals to show clinical signs of Johne's as well, and for them to be shedding bacteria. And pretty much if it looks like this, it is. So the rate of clinical signs and onset of shedding is linked in the amount of bacteria that the animals were exposed to as calves. So if you've got an animal that's quite young, 2 or 3 years old, coming back as infected with Johne's, then there's a good sign that that animal had experienced a huge amount of Johne's when it was younger. We know that stress plays a huge part in the role of the onset clinical disease. And if we look at the year, those months of culling throughout the year, August, September of when those deaths are occurring, it coincides with the periods of stress during that calving and the transition through to early lactation. But the data is only as good as the data you enter into MINDA, and we know that farmers could be adverse to recording Johne's into MINDA. But we just want to point out that when you enter cows for Johne's into MINDA, we don't share that with a third party. Johne's can cease to be a notifiable disease in the year 2000. So there's no register for Johne's positive herds in New Zealand. And the more information you can enter into MINDA, the easier it is for the industry to understand the disease and its impact on farm, which Brendan will go into more later. So Jerseys do have a higher risk of Johne's when compared to crossbreeds and Friesians and Ayrshires. The increase is susceptible of Jerseys to the infection and the clinical expression. So in the South Island and North Island, if we look at the distribution of herd tests that we did for the 2019-2020 season, we can see that around 70% of those herds were from the South Island and around 30% from the North Island. So it matched quite nicely with the distribution that we were thinking of Johne's, which was about 60-40 split. So for the last season, LIC tested 945 herd test herds for Johne's. Of those, 14 had no reactors, 4 were new herds, 9 were multi-year testing that had reactors previously, and only 1 was multi-year testing that they were consistently negative. So distribution over the Waikato in the last 6 years. So this is a stylised map. You won't be identifying your neighbours or anything like that. So we've just grabbed the numbers and plonk them on the map. But what it basically shows is that there's an even distribution of Yonis through the Waikato area rather than isolated pockets. This only represents the herds that have used the herd test product, but we know that the disease is widespread and this map actually reflects that. So this doesn't include any farms that have had a positive blood or farms that are culling for Yonis. We know that only 8% are recording JD culls on Minder, so that would equate to around 300 herds in the Waikato, or about 157 herds over the last 6 years. So really only a fraction of herds are actually testing whole herd. So basically, this is a New Zealand-wide issue. It's widespread. You're not alone, and this is an industry problem, and we're here to help tackle that problem with you. You need to protect your young stock from infection. Testing and culling is also part of a robust management plan to manage this disease.